My name is Josue Avecillas. I was born and raised in Ecuador, and when I did my medical school, then I moved to Spain to do my general neurosurgery training and my PhD in neuroscience. Then I became interested on brain mapping, which is a series of techniques when we identify and map the brain circuits and how we can use in clinical practice. So this motivated pursuing a fellowship training, and then I came to the United States to do functional neurosurgery training in Mount Sinai, New York, and also brain tumors radiosurgery in Cleveland Clinic. I became fascinated with neurosurgery because of the brain is one of the most complex organs in the body. The anatomy is beautiful, and also we have this challenge to know how the brain works, how the disease process happens, and how we can come up with cures for these different diseases. And you know, this is from medicine in general. You have this science part of medicine when you have this challenge to discover things, but you also have this other side of medicine which is more human. When a patient had a problem, you immediately become a very important part of their lives and be able to listen to them, guide them through the disease process, and be able to help them with the knowledge that you have acquired over the years is absolutely priceless. The type of patients that we see in clinic are patients with what we call brain circuit disorders. So there is no stroke, there is no tumor, there is no bleeding affecting the brain function. This patient has a circuit dysfunction that we are not able to see in imaging. For example, patients with Parkinson's disease, patients with tremor, patients with dystonia, with chronic pain, epilepsy, and occasionally we can also see patients with depression, Tourette syndrome, and patients with OCD. For example, when I see a patient in the clinic, let's put out the example of a patient with chronic pain. So patients with chronic pain come to the clinic after seeing many doctors around. They come with a very large list of medications, and usually when they come to surgery, we are the last resource for this patient. So I would like to see this patient in a very detailed manner. I go to the previous reports, see the reports very detailed, and have a very detailed neurological examination. But the most important part for me is to know how this pain is affecting every aspect of their lives. One thing that I love in Nebraska Medicine is that we have medical students, we have residents, we have fellows. So we have that privilege to train and educate this new generation of doctors. But on the other hand, we also have these senior faculty in different stages of their careers, so I can also learn from that.